Hi everyone, welcome to I think this is our fifth webinar, but we're going to be starting to do this quite often for our ALF training series. And today on the phone, once again, is Cheryl. How are you doing?
Hello, and I have the cat with me.
Okay,
Just kidding. He's sitting with me.
he's,
So, so Kitty Chemo is here too.
yeah, he's a perfect little cat. So today we're going to
He's
cover,
probably just begging.
yeah, we're going to cover a survey that happened, it was in 2014, but it's
The
all
end of the
relevant.
year.
Yeah, that's true.
So,
And you know, it's funny, we just went through our annual survey, which was so much fun. And it was,
uh,
I can't tell you how much fun it was. And I'm so sad it's over.
no,
But
you're not. They're
yeah,
coming back though.
they found
So
some
we're
new
not
deficiencies.
perfect. We're
No,
not perfect. We got
nobody's
some tags
perfect.
too. But some people are perfect and they have all their money spent on administrative staff and they don't get caught on the care side.
It is so hard. Well, I mean,
We weren't even ready for inspection. I mean, I tried.
yeah, but we're going to cover our survey and our inspection when it's out and completed and the whole process is done. But some of the things that this survey, this facility was cited for, some of the same things we were cited for.
Right.
So it's good to know they're going to be looking for these things. And the thing about one of the things that we got cited for, Cheryl, is that we knew it, and it's just something that got overlooked, and it was something so simple. And you know, we're going to make sure that the system's in place so that it never happens again. And we'll talk about that once we get into this survey. So
Right.
yeah, I just want to remind you that these webinars are included in our continuing education courses, so you can get credit for them if you purchase our continuing education, but they're also just free on our YouTube channel, or they're going to be posted on the careassociation.org website under the training link. And the careassociation.org is the Association of Small Care Residences, where we work to promote the benefits of smaller assisted living facilities and help educate the public about the role that they play in long-term care. So that being said, Cheryl, let's dig right into it.
All right. Well, this facility, well, I thought it was larger, but actually only has 38 beds. They have an LNS license. I think it's the memory care part of a larger community, but 38 beds, so it's not too far from what we have.
Can I stop you? Do you see the survey on the screen?
Oh, I had it pulled up on mine. Hold on, let me check. I do,
Okay, perfect.
but I'm looking at mine because it's just zoomed in.
Okay.
It's easier to read. All right, so the first thing they got cited for were health assessments, the 1823 forms, and they were incomplete for three of the residents that they reviewed, so 3 out of 4. And this is funny because was it like maybe 2 weeks ago, we did an assessment at a different community on someone, and the first thing I noticed was their 1823 was incomplete. So that's just something that I know most people don't get it prior to admission. We do. Otherwise, it's just, so hard to obtain again or, get the missing blanks filled in and stuff like that. So you and I, we get the 1823 prior to admission, and then we go through it and make sure every single line is filled out. And if not, we get it corrected before they move in. That's just one good tip to always having your 1823 filled out because they will check these.
Yeah.
But
And
nothing
it's a good
big.
idea as well, of course, to audit because you're still going to find things that you overlooked.
Yes, I was surprised when we did the audit. I found little missing things, and I thought I mean, you can never go look at them too often. I mean, it's a second pair of eyes too, because sometimes I'll check it, but you get sidetracked or it's just a lot. It's just a lot. So
And of
it's always
course,
good to have a
they
checker.
need to be updated. In fact, that's one of the things um, we got cited for, I think, was
Well, let's not get started into that because I want to say some freaking colorful words, but let's just
okay,
wait
okay,
till
okay.
well, let's wait till they come back
But
and
anyway,
because we don't
yeah.
want them to hear this and they're like, okay, I'm gonna come out with some guns blazing.
Well, no, anyway, the health assessment form, of course, not only does it have to be filled out completely, but it has to be updated under certain
And how
circumstances.
about this one? Somebody going on hospice is considered a significant change, so they will need an updated 1823 when that person goes on hospice that same day. So make sure you get those
Yeah,
along
when
with the interdisciplinary care plan.
right, and when yeah. So you got to just make it a part of your admission process for hospice patients. So, okay, so they got cited. I
It was
mean,
just like random blanks,
Page
ADL.
2 is missing
Oh, but
comments.
look at this one. Page 2 had both supervision and assistance ADL box checked with no comments. Okay, then. I guess you have to put comments on the side.
Wait, hold on a second.
Do you see that?
A record review is conducted on resident 1.
Look at number
Resident 1 health
10.
assessment dated. Well, let me finish reading this.
Mhm.
Page 1 was missing residents' weight and height. I'm sorry,
Yeah,
height
that
and
happens
weight.
a lot.
Okay. Page 2 was missing comments for activities of daily living. So there was a no checkbox, I guess, for.
No,
Page
if you
3 was
read it.
missing comments for tasks. Page 5 was left blank. So basically, I think what they mean by comments, they mean the little checkbox. I don't think it needs comments. I just think the checkboxes were missing for those.
No, 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 no. I think it's the boxes were checked that they needed supervision. They didn't have the comments on the side. And it's probably just somebody being picky. Because I know we have 1823s with comments and without. I mean, is there an
So they're
actual
so they're
exact rule that says it has to be filled out? I'm not sure.
I can't. So you think that they got cited?
Look at page 2 had both supervision and assistance ADL boxes checked. They were checked with no comments. So this person's just nitpicking 1823,
Wow, I can't tell you.
right?
But there's
That's just my
probably one
interpretation.
person in our whole place that has any comments in that section. It's
I
always a
know.
checkbox. But that's brutal.
Right, that's brutal. That's what I'm saying. Like we had our 1823s audited. We didn't get tagged for that.
We didn't.
Oh,
No.
please don't come out and do it.
Okay, so resident number 10 health assessment dated November 6th was incomplete for the following reasons. Page 1 missing the height and no medical history.
A lot of times they leave those off.
Yeah. So sometimes they send the medical history separate, so they just need to put like see attached medical
Attached.
history or something. So that would be something that if they leave blank, then you would need. How would you have to do it, Cheryl? Technically, you'd have to call the doctor, speak to them, and say, "I see
Yeah.
that you attached the medical history. Is that correct?" And then they would say
Good luck
yes.
getting past the gatekeeper,
Right.
secretary.
But
They're
then
never going to let you talk to the doctor.
or you could tell them, like technically you can't just write see attached in there. You'd have to call them, speak to the nurse or the healthcare provider, and then they confirm it. And then I guess you could write it and then make a little notation that spoke to, nurse for Dr. So-and-so, and they said that the medical history was attached.
Hmm.
You could also just call them and say, can you write see attached in that page and fax it to me?
No, I think it's better to get the 1823 prior to admission and hand it back to the family and say this has got to be filled out.
Yeah,
Yeah, it's easy. Let them do it.
right,
But
right.
once they move in, you're never going to get those things done. It's just so difficult.
No.
I mean, it's
Um,
possible, of course, but it's an extra task for you now. You're
And it's
chasing.
and it's really hard because I've had it happen in the past where, you're doing your part. Where let's say you take it on their word, they're gonna get it because you're in a bind, they're in a bind, they need to move quickly. It's gonna happen. They cannot get to their doctor. It is gonna
Yeah,
happen, and you do have to fill your bed, right? And you can't just leave it vacant and
right.
this
I
person's
mean,
gonna
it
go
happened to
someplace.
us.
Right. So they move in. You remind them, okay, I need this form. Okay, okay, great, we got it. Our appointment's next week, Tuesday. You get busy, you forget, they cancel the appointment, they don't go, they go to the appointment, they don't get it. Another week goes by, and then you remember all of a sudden, oh my God, I need to get the 1823. We're 2 weeks into his residency, so now you go and tell him again. They say, oh, okay, great, okay, okay. Or you fax the doctor and you say, hey, I need a medical health assessment form, and then everybody says they're going to do it, and then another week goes by and it doesn't happen, and you forget. So the time's ticking so it is extremely hard once they move in to get it, but I understand it does happen. So
Mhm.
what's next here? Resident
Um,
11 health assessment was
yeah, those are
incomplete for the
just,
following reason: missing physician address and phone number. Page 5 was left blank. Page 5, is that the care plan?
yeah, that's the care plan and the administrative signature. Probably, I don't have it pulled up. Anyways, the 1823s weren't filled out completely. That's something that you can audit over and over again and get those filled out completely. So let's move on.
Okay.
Because the next one is um, it's interesting.
Okay.
Okay, next one they got cited for was resident care. The resident rights and facility procedures, which I think that this was one of the higher tags on the 2014 list. So they interviewed residents. They interviewed 8 residents, and they found out that 2 of the 8 residents, they felt that they weren't being treated with consideration, respect, personal dignity, and individuality. So the facility was waking up the residents, these 2 residents, number 10 and 11, before 6 a.m. They were getting them dressed and putting them back to bed.
Hmm.
Got anything to say about that one? Don't wake me up.
Wow.
Don't wake me up and put me back to bed.
So what do you
I mean,
think they told? Like,
so
this
well,
is
I'll tell
funny.
you
Like,
what goes further. I just wanted to pause.
okay, go ahead.
Okay, so what they did was they interviewed the residents. The residents told them, hey, that we're getting up before 6 a.m., getting put back in bed. So what they did was they called a staff member that works at 10 p.m. to 6 a.m. shift. So your staff's going to throw you under the bus all the time, just so you know. But they're telling the truth. It's not a lie. It's not that they're really throwing them under the bus. So they called the staff member that works the overnight shift, the 10 p.m. to 6 a.m. And what they did was they asked him or her um, what's going on. Are they getting residents up before 6 a.m.? And the staff member said it's hard because they have to start getting residents up at 4 a.m., get them dressed, and take care of them before the 6 a.m. shift starts. So what they found was that they interviewed another direct care staff too, and this is someone that comes to work, after 6 a.m. She starts at the 6 a.m. shift. She probably leaves at 10 to 6. And she said that the facility has a policy that they have to get at least 4 residents up and get them dressed before the 6 a.m. shift starts. And she further stated that the facility has a list of people who are to get up and get dressed before 6 a.m. And they interviewed another staff who works a 6 a.m. to 2 p.m. shift, and she said that the 2 residents, number 10 and 11, they're woken up and dressed and then put back in bed before she starts her shifts at 6 a.m. because these 2 are a fall risk. So they have to be put back in bed because obviously they have no supervision. So they also interviewed the resident, said she would like to sleep in some mornings, but she's woken up. So they also interviewed the director of nursing, and the director of nursing stated that there is a get-up list, and she provided the list. She stated that the 2 residents on each hall are gotten up and dressed before 6 a.m. shift starts. The 8 residents that are gotten up are all early risers except 2 that are fall risk. And she further stated that 10 and 11, they are dressed and put back to bed because they cannot sit out in the lounge unattended. But Clay, don't you think that if these residents wanted to sit out into the lounge, that they should provide staffing? I mean, that's how they're going to look at it, right?
Mm-hmm.
I mean,
Well, it is, all of this is because they just don't have the amount of
they don't have the staff,
staff.
right? So they're cutting like 10 a.m. to 6. So they're saying, hey, you need to get these people up, get them dressed before the 6 a.m. shift starts to make it easier on them, right? I mean, they could just have an overlap, 6 to 7 or
Well, I mean,
6 to
yeah,
8.
you'd have a
They're just
part-time shift or something come
yeah,
in
they're
and,
just cheaping out on staff.
but that's, when it's busy at certain times, and it's
Right.
not, I mean, there's dead times, and wake up time, breakfast, meds are the busy times,
Busy, busy, busy. I
and
mean,
they're
if
getting
someone
away
is
with,
up, yeah, get them up. Get them
yeah,
dressed, help out. But, I bet most people would sleep till 6 or after
yeah,
6. So what they're doing is, they're they're making the most out of their staffing schedule, and they're punishing the residents and in the eyes of ACA and the eyes of the residents by making them get up at 4 in the morning and get dressed and get ready for the day.
hmm
Just so when the 6 o'clock comes, just saving on staffing.
yeah. Yep, and don't be surprised too. Just it may not be your policy, but you never
I
know.
think
You may
it's
have employees who come in the day shift and tell the night shift that
require,
this is what I want you to do before I get here. And
hmm
then all of a sudden it's happening and you just didn't even know it as an administrator. So Got to be
Yeah.
aware of that. That if you want your residents to be able to sleep in and wake up when they want, if you're telling families that on a tour or something like that, then you need to be sure that that all of the staff understands that as well.
So what's interesting and what, also, so they had a record review of the resident number 10, who was one of the ones that was 10 and 11, both the residents that were being woken up and getting dressed and put back to bed before 6 a.m. So they provided their facility, their residents, with a questionnaire upon admission, looks like. So it says like their preferred wake-up times. And resident 10 put between 6 a.m. and 7 a.m. Resident 11's preferred wake-up time is between 7 a.m. and 8 a.m. And they wanted to be dressed during those times too. So they're clearly not honoring the resident questionnaire request sheet either by waking them up, prior to 6 a.m. So that's just, how they're doing their staffing and kind of cutting corners. And I have to
Yeah.
imagine LNS and
Well, it's
Medicare,
funny, if you're not going to do that, then why even ask?
right?
Why ask the resident?
Because that's all the part of the fluff,
I know, but it's
Because
funny. Like,
listen,
I
so
don't
we
understand this, Cheryl. Like, you read stuff like this, and this is obvious. The reason why they're doing this is they're just cutting on. They don't want to spend money on the caregivers at that time, and it. Why do they treat us like we're criminals, because we have some menu citation or
we have
something, and
vegetable
we
juice.
have like so much staffing, and it's a
Okay,
little
so
frustrating. Go
we
ahead.
have 32 beds. Like, I mean, right? We have 25 beds really at the time, right?
Hmm.
What do we have? 4 caregivers on duty for
Hmm.
25 people, and we get in trouble for vegetable juice not being there that nobody wants.
I know.
And
I know.
it's
I know.
disgusting and it's bad for you.
Well, there's a lot of sodium, right? But people,
Yeah,
I know everybody listening to this has had the state come in and guns blazing like you're a criminal, and it's a little
I know.
frustrating. It is a little frustrating when we're all trying to do the right thing, and there are bad guys out there, but
We
they
just
don't
take
have
a
to.
breath and
Yeah.
we look at each other and we say, we did the Lord's work today. We tell our staff that, you know,
Okay.
we're, we're, we're we're here for a reason,
I
doing the
just
Lord's
think
work.
that they could be kinder. The surveyors could be kinder, and they could be mean to those that if they find something, and um, we're just trying to do the right thing here. We're not trying to, just. But anyway, that's as you can tell, our survey has been a fun event for us. Okay.
Well, I guess they should have thrown away these questionnaires about their preferred
I
wake-up
know,
times.
right? That's funny.
Probably
That's
would have
funny.
gotten them in
Well,
less
like I said,
trouble.
why ask?
Yeah,
Yeah.
true.
Okay, so the
But
next thing they got.
we will provide as much staff as necessary.
Oh yeah, we heard that before.
We've
Okay.
heard that before, right? Okay. The next one's really easy too. It's staff in service training. We're all going to get signed up for that eventually. It's just, especially the surveyor. Well, one thing our local surveyor said they love the ALF training certificates, which I thought was really good because they know us, they know it's from a approved training provider, and they know the courses are good. So they like seeing those in the file. In fact, I had someone who's worked for us for 6 years who didn't have a training certificate from us because they took it at a different facility and they didn't want to accept it. They wanted only ALF training certificates. So I guess that's a compliment.
Hmm.
And so, they got staff for some training things, which kind of surprised me because I thought that this
So
company
what
had
did they?
in-house training,
Staff
but
A did not have training documentation for active ADL and
yeah,
behavior needs, elopement
emergency.
training, emergency response and preparedness, incident report training,
They
and
have a lot.
recognizing abuse, neglect, exploitation. But yeah. Well, some of those things are done by the facility. They should have been done
Right. A lot of it, I think these some of these communities have in-house training, but when you're reading through the inspection, you also see that some of the people said they were new, some of the people in
Hmm.
management, so they may have just had turnover in, administrative staff too, trying to clean things up,
Yeah,
or
and let me
there
tell
being
you,
things fall
I
through the
I know
cracks.
that anybody listening to this has had some event where an employee no longer works for you for whatever reason. They quit, you fire them, whatever it is. All of a sudden, you have a need, and you have to hire somebody. And
Yeah, today.
luckily there is some grace period to get some of this training because you have to be able to staff your facility. Um, Yeah, so, but staying on top of your employee after they get in and then remembering to do all that. I just want to make a note. We are developing a compliance tracking system that will help you remember all of these tasks for new residents, new employees. It's going to be a big, big help. I know everybody's going to love it. So it's pretty close to launching, I'd say a few months. Um, okay, so a record
Yeah,
review is
so
conducted on direct care staff B. Staff B had no training documentation. Same thing.
yeah, same
Um,
thing. I mean, these are kind of boring because like this was the highest cited deficiency last year, anyways. I mean, I think that's what they're focusing on this year.
mhm.
So definitely audit your files over and over again.
Yeah,
Make
your
yourself a
employee
checklist.
files. Your
Yeah,
employee
because they
files.
will ask for those.
Okay. Next.
Um, they didn't have the Alzheimer's training in their memory care facility, so that
Yeah.
was a big tag
Well, one of
for
three, right?
them. Yeah, but I mean,
Yep.
how
Yep.
many employees do they have? They only audited a certain amount of files, so
Right. Right. So the Alzheimer's training, you need level 1 within 3 months, level 2 within 9 months, and then after the 9-month mark, after you get that second level 2 training. So let's say you got everything in 6 months, then the year starts then, and then you need the annual before that last date. Okay. So that every year your staff need the annual. And of course, my ALF training, we offer it online, so it's really
really
convenient.
easy.
If you're a big facility with a lot of memory care, I mean,
We should call these guys and tell them.
just buy our subscription package, and you just get it all included. Okay. Um,
So,
ADRD. Let's skip to the next one. Do not
and then they have
resuscitate orders.
the DNO training, DNRO training they didn't have, and policies and procedures. Just more
Uh,
training stuff. I mean, those things are going to happen. It's really not a big deal. It's just class threes.
yeah.
But you will have to get those corrected when they come back out. So when they come back out to inspect, make sure that your staff has all the training, and not just those staffs that you were cited for. Make sure everybody has them. So you're going to have to go through and do a big audit.
Well, we have the DNRO training as well.
We do.
These are avoidable. I mean, but we understand because,
Things
like
get
you.
busy.
Okay, what else? Staff A and B were missing documentation to show that they received the training, so they didn't have a certificate. Um, Office manager stated she didn't know why they didn't have the training. Okay.
Yeah, over and over she repeated that same thing.
Yeah, dietary standards. Next citation they
Oh
got
yeah.
was food
So
service dietary standards. Go ahead.
they observed 32 out of 32 residents, and they did not offer a substitute. So go ahead with the findings, Chloe.
Based on observations and interviews, the facility failed to follow the approved dietary menu for all the residents and did not offer a substitute. On um, November 18th, interview was conducted. During the interview, resident 5 was asked if there was anything the facility could do for him. The resident stated he likes salad and they need to serve more salads. He asked for a salad the other night and did not get it. So they are going to ask,
They're
they're
gonna
going to ask
ask.
the residents like, hey, the menu says you have salad. Do you want a salad?
Right.
Oh, I would love a salad. I
I would
love.
love a salad.
And you're
So at the noon meal that day at 12 p.m., they went into the dining room and they looked at the menu and it said that they should have a pickled bean salad. And that's part of the meal today. So they observed that none of the residents received a pickled bean salad during the meal. So at 1:45 p.m., they interviewed the facility chef, and she was asked why the pickled bean salad was not served with the noon meal. And she said that the residents do not like salad and they do not serve it. So the surveyor asked if she served a substitute for the salad, and she said no, she did not. So they may not like that particular salad. I mean, let's
Yep,
give her the
but they're not
benefit
a
of the doubt.
substitute.
It sounds a little funky, pickled bean salad.
Well, and it's like here you go again, getting penalized for having too
Something
specific of a
silly,
menu. I mean, if if you're a
right?
smaller place and you have all these our menus when we first got them, they had things that I didn't even know what they were. And what was it?
Ambrosia kit.
Ambrosia. They had
We were looking stuff up on
weird
the internet.
desserts. So being too specific can hurt you because you're just not going to have it. I mean,
Right.
the reality
Which is
is
hard.
it's hard, but what we started doing recently, again, well, we've been reinforcing it, is that we tell the staff to follow the menu. The person who buys the groceries, look at the menu before you go. Everything that's on there, get it. And the staff understands that if there's some sort of bean salad and you don't have it, right? Then you just need to go and offer a substitute. But who doesn't have a can of beans and chop up some red onion and cilantro? But you don't
Yeah,
have
but
to
I
make
wouldn't
it
think
as
about
long
that.
as you offer it, right?
Yeah, but you have to, I mean, offer it, but what you just never know when that one person is going to say yes, and then if you don't have it. So
Well, no,
if you
have
don't
it.
if you
Yeah,
don't have the intentions of making it, then you have to substitute it.
substitute. But some of the meals, there's just too much food. I know
There's
that
just too much food.
it's
So
too
much
much.
waste.
It is a lot of waste. So if the
I
best,
don't eat like that at home. I
I
mean,
mean,
it's like,
if you have 20 residents and you actually ask them all, do you want bean salad? You're probably going to get 3 people that say, yeah, sure,
right.
throw bean salad on there. So you may as well just,
Might
if
as
you
well
don't
have
have
it.
it, just make some sort of substitute. I guess
You
that's,
can make a regular salad
yeah, I guess
substitute.
pickled bean salad. Okay, well, anyway, they're
Whatever.
gonna they're gonna check everything on
They're
your
gonna
menu.
check you. That's
Well,
that's the point.
like what did we have, Cheryl? The thing that set them off is that
But
our
you'll have a
menu,
chef. We don't have a chef, and you know that's your
our
designated job.
our menu said that we had it was a
Vegetable
vegetable
juice.
juice was a choice of a beverage on
Nobody
that menu.
wanted it.
Was every once or 2 or 3 weeks we have vegetable juice on there, and we didn't have it. But no, remember the surveyor did ask, "Do you want some vegetable
You
juice?"
want some
Oh, I would
vegetable
love
juice?
some vegetable juice.
No, only one person. And then they didn't even want to drink it. All right, let's not go there because
Okay, all right, we'll
we have to
save it.
get we'll pick apart our facility soon
Okay,
because we don't want people to feel like we're picking on them because we're just
well,
equally as
no,
fun.
I'm telling them what happened to us.
I know, but
Yeah, okay,
we're not
so
through our re-inspect. They're
okay,
coming.
okay, records,
They're coming.
resident records based on
This is
record.
just someone who runs. So it's like you deal with the state,
Yeah,
but you want to pick them apart right here.
who me?
Yeah.
Oh, okay,
So then when
based
they
on
come and you'll go hide in the office and I'll have to deal with it.
oh well,
Yeah.
let's move on.
All right, let's
Based
move
on record review and interview, facility failed to maintain required documents on the premises of the facility. So resident
except for LNS
records,
stuff. Goodness gracious.
a
Someone
review.
take this call.
Can you mute your mic? A review of resident two's record showed resident two's chart was missing. Therapeutic records, wound care orders, notes, and medication orders. Okay. Um, on November 19th at approximately 4:30, an interview was conducted with the director of nursing. The director of nursing denied knowing the order and records were to be maintained. Okay. So therapeutic records, wound care orders, notes, and medication orders. Sounds like orders were missing. So I think that's it. I want to just touch on our Association of Small Care Residences. We are going to be having annual meetings, so it's going to be a place where um, all administrators can come together and we can have open dialogue about the things that we're dealing with and the issues that have come up and how we've dealt with them, from um, Medicaid reimbursements to dealing with a weird situation, employee issues, payroll issues, whatever those issues are, we can have those discussions and share with each other. And we've done it many times. We had a lot of meetings in our area here in Brevard County, and our group, we learned a lot together. We got to have, um, we could speak openly. It wasn't like somebody just speaking the whole time, telling us things. It was more about sharing and learning together. So our meetings are going to be regional meetings, similar to the ALF joint training meetings. The first one we're going to be doing is in Central Florida, so we'll probably have Central Florida, South Florida, maybe something in Tampa, and then maybe Gainesville area. I'm sorry, Jacksonville area. So we'll do these 4 regional meetings. We're going to bring all the administrators together. It'll be free. If you want continuing education credit for it, then you can pay for it. Otherwise, it'll just be a free meeting for everybody. We will have speakers to talk about different subjects that are relevant to running your facility and what we do. So I think that if you want to know more about it, follow the CARE Association. Go to the careassociation.org website. That's careassociation.org. And if you purchased any training from us, then you're on our email list. You can also email us at support@careassociation.org and let me know that you want to be a part of it. And if you have a small facility and you want to be on our resource guide, our directory, which is at the website, all you have to do is find your facility, and then there's a little link next to your listing that says business owner with a question mark. You just click on that, and then, in fact, let me just take you there.
I'm back.
Okay, hold on a second.
Sorry.
I think we finished the survey. I was just telling everybody about our Care Association meeting that we're going to be having.
Okay.
And
yeah, the survey was finished.
Survey's finished. Yeah.
Yeah. I just want to say one thing, because I don't want people to think we're picking on facilities or anything. I mean, we're all going to make these mistakes. We've had some terrible mistakes at our place too. It's just that this is a learning opportunity, a learning tool. I mean, please don't feel attacked.
Nobody feels
we're all
attacked.
doing the Lord's work, and we're caring for people, and we're trying the best that we can, and so that's my positive speech.
Well, no, I mean, we're all learning from each
people.
other. We're learning
Yeah,
from
we're
each
learning
other
from
so
each
that
other.
we can provide, better care. Okay.
That's the good thing about the meeting.
That's right, and that's the point, is that we're going to be able to have these dialogues, and people are going to say, I got cited for this because of this, and we've learned from meetings, about the RN signing. You're in 32937 zip code, and you hit search.
Hey, Clay.
Yep.
This just picked up again, so I didn't hear anything you said, so I don't know if it recorded.
Oh, when did it break off?
Right away, pretty much.
Okay, but I think maybe you didn't hear it.
Yeah, that's what I was just checking.
And so if you do a search by zip code, then you can find your facility. And so, for example, let's say your facility is Salis Beachside, then what you'll do is on the right side, you see where it says business owner, you go ahead and click on business owner, and then you can add all of your information there. You can add pictures, similar to the way we have our listing. I think you can add your website. You'll be on the map. You can add a description, and see on the right it says owner verified listing here, and it's got all your information. So if you want to go ahead and claim your listing, go ahead, and we'll be in touch about that meeting. Up at the top of the page, you see it says ALF Training, and that's where we post all these webinars when they come up. And then also the become a member. So if you want to be sure that you want to get on the list so that we let you know about events and things like that, just go ahead and click on fill out the membership application. It's free. That's it, Cheryl. Anything else for now?
No, that's it. Thank you.
Thanks, guys. Bye.
Sorry. All right, bye.